Welcome back to Medic Talk, everyone. Today, we're diving into a condition that's pretty scary, actually. Sepsis.
Yeah, sepsis is not something you hear about every day, but it's way more common than people think.
Right. Over 1.7 million cases just in the U.S. each year, and it can be, really dangerous really fast. So, before we get into all the details, maybe we should start with the basics. What actually IS'd sepsis?
So a lot of people think it's just like a really bad infection, but it's more than that.
Yeah, I kind of always thought that, too.
Sepsis is actually your body's own immune response going completely haywire.
Well,
It's like, imagine your immune system is like a security guard. Usually it's doing a great job.
right, keeping the bad stuff out.
Exactly. But with sepsis, that security guard kind of goes rogue and starts attacking everything, even your own tissues and organs.
So it's like friendly fire from your own body.
Exactly. And that friendly fire is what causes the crazy inflammation, and that can lead to organ failure and even death. We actually used to think about sepsis in stages.
Oh, yeah, I remember learning about that. Like sepsis, severe sepsis, septic shock. Right.
Right. But it's not that clear-cut anymore.
Oh, really?
Yeah, now we understand it more like a spectrum. It can range from a mild infection to, bacteremia, which is when bacteria get in your blood. Then it can potentially become full-blown sepsis, and in the worst cases, septic shock.
So it's not about putting it in a specific box. It's more about how bad it is.
Exactly. Because it can change really fast.
Wow. That's pretty intense. So anyone can get sepsis. But are there certain people who are more at risk than others?
Definitely. Age is a big factor. So older adults over 65, and then newborns and infants.
That makes sense. Their immune systems aren't as strong.
Exactly. And also people with chronic conditions like diabetes, obesity, cancer, kidney disease, those sorts of things. Or if your immune system is weakened for other reasons.
Like if you're on chemo or something.
Right.
What about people who are already in the hospital?
Oh, yeah, for sure. Being hospitalized, especially if you have things like catheters or IVs or breathing tubes, it just gives bacteria more opportunities to get into your bloodstream.
So basically anything that weakens your body's defenses. But what about the symptoms? How do you even know if you have sepsis?
This is the tricky part because the symptoms can be all over the place. It's kind of like a chameleon, but some common red flags are like changes in how much you pee or if your pee is really dark, feeling super weak and tired, a racing heart, low blood pressure.
Okay, so those all sound pretty serious.
Yeah, and fever. But here's the thing. Sometimes a really low body temperature can also be a sign.
Wait, really? So you can't just rely on fever as the only indicator?
Nope. And keep an eye out for chills, clammy skin, confusion, rapid breathing or shortness of breath, and extreme pain is another big one.
Wow, that's a lot to remember. Is there anything, visually, something that might help distinguish it?
There is. If the sepsis is caused by what we call blood poisoning or septicemia, you might see a specific kind of rash, red, discolored skin, usually with these small, dark red spots.
Okay, so that's a big one to watch out for. So we've covered who's at risk and the symptoms, but what are the actual causes of sepsis? Is it always bacteria?
Well, bacteria are the most common culprits, but really any kind of infection can trigger sepsis. Fungal infections, parasites, even viruses, it all comes back to that immune response we were talking about.
Right, so it's not about the specific bug, it's about how your body reacts.
Exactly. The real issue is that out-of-control inflammation. But knowing the common sources can help us, prevent infections in the first place.
Okay, that makes sense. Can you give us some examples of the usual suspects, maybe organized by, body system or something?
Sure. So starting with the respiratory system, pneumonia is a big one. For the urinary tract, it's often UTIs, especially if you have a catheter. And then for the gastrointestinal system, things like appendicitis, bowel problems, infections of the gallbladder or liver can be triggers.
So it's not just one specific organ. It can affect pretty much the whole body. What about infections in, the brain or the spinal cord? Can those lead to sepsis?
Oh, definitely. Infections of the central nervous system are a big concern. And skin infections, too. Like if bacteria get in through a wound or even through those tiny openings from catheters or IVs, cellulitis is another one to watch out for.
Makes you think about how easily these things can spread. Can you actually catch sepsis from someone?
So sepsis itself isn't contagious. You can't like directly transmit it to someone else. But the infections that cause sepsis, like the flu or a skin infection, those can be contagious.
Okay, that makes sense. So it's not about catching sepsis, it's about preventing the spread of those infections.
Exactly. Basic hygiene like hand washing and covering your mouth when you cough or sneeze, those things go a long way in preventing those initial infections in the first place.
Right. So given how serious this is, early diagnosis has got to be crucial. How do doctors figure out if someone has sepsis? Is there, like, a specific blood test?
Early diagnosis is absolutely key. But unfortunately, there's no one single test for sepsis. It's more like detective work, putting the pieces together.
Okay.
They look at the symptoms, physical exam, lab tests, maybe x-rays. They try to see if everything points to sepsis.
So it's not a yes or no answer. It's about looking at the big picture.
Right. One tool they use at the bedside is the QSOFA score. That stands for Quick Sequential Organ Failure Assessment.
Okay. What does that look at exactly?
The QSOFA, it focuses on three main things: low blood pressure, a high breathing rate, and the patient's level of consciousness. They'll use the Glasgow Coma Scale to figure that out.
It's kind of like a quick snapshot to see how critical the situation is.
Exactly. It helps them decide how aggressive they need to be with treatment.
Makes sense.
But they'll also do other tests to confirm if there's an infection and to see how much damage has been done to the organs.
Some kind of tests?
Blood tests for sure. A CBC, blood cultures to find the bacteria, checking liver and kidney function, clotting factors, electrolytes, blood oxygen levels. They might do urine tests too, and imaging like x-rays or CT scans.
Wow, so a lot of different things to get a full picture.
Yep. And remember, time is really important with sepsis. The faster they diagnose and treat, the better the chances of survival.
So speaking of treatment, what does that typically involve? I mean, it's a medical emergency, right? So I'm guessing it's pretty intense.
You're right. Sepsis is definitely a medical emergency. Treatment has to start immediately, and usually that means the ICU.
Okay, so what are the main treatments they use in the ICU?
Well, antibiotics are the first line of defense, especially if bacteria are the culprit. 4V fluids are also super important to keep the blood flowing and prevent that dangerous drop in blood pressure.
I'm guessing they also use something to directly raise blood pressure too?
Yep, they use medications called vasopressors.
Okay.
Those basically tighten up the blood vessels. And of course, there's supportive care. That might include dialysis if the kidneys are failing, or a ventilator to help with breathing if the lungs are struggling.
So it's about supporting the body while fighting off the infection at the same time.
Exactly. And sometimes surgery is needed to remove infected tissue. But it really depends on the situation and how severe it is.
So it's a very tailored approach.
Absolutely. Every case is different.
This has been super informative, but it's also, like, kind of scary to think about how fast things can go downhill with sepsis. Is there anything people could do to prevent it in the first place?
Oh, definitely. There are a bunch of things. The most important is probably good hygiene, washing your hands a lot, and really well. Keeping any cuts or wounds clean and covered until they're fully healed.
Those are good habits to have anyway.
Right. Staying up to date on vaccinations is also crucial, and managing any chronic conditions you have with regular medical care. And I think most importantly, if you think you might have an infection, especially if you have any of those symptoms we talked about, go to the doctor right away.
So don't wait. Don't ignore the warning signs.
Exactly. Early treatment is key.
That makes a lot of sense.
Huh.
Now, what about life after sepsis? Like, what can people expect in terms of recovery and long-term effects?
Recovering from sepsis, well, it can be a long and tough journey. It really depends on how severe it was and the person's overall health. Some people bounce back pretty quickly, while others have lingering problems.
What kind of long-term effects are we talking about?
A lot of things, actually. Physically, there can be fatigue, shortness of breath, aches and pains, trouble moving around, problems sleeping, loss of appetite, weight loss, even changes in your skin, nails, or hair.
Wow, that's a lot to deal with. What about mentally and emotionally?
Yeah, sepsis can take a big toll on your mental and emotional health. Survivors often experience anxiety, depression, PTSD, trouble concentrating, memory problems. Some people even have flashbacks to their time in the ICU. And then there's the feeling of isolation or frustration that can come with all those changes.
So it's not just about physical recovery. It's about mental and emotional recovery, too.
Absolutely. It's crucial for survivors to have support from loved ones, healthcare providers, and even support groups. There's help out there.
That's good to know. What about the risk of getting sepsis again? Are survivors more likely to get it a second time?
Unfortunately, yeah. Having sepsis once does increase your risk. So survivors need to be extra careful about preventing infections and getting treatment right away if they do get sick, even if it seems like a minor illness.
So early intervention is key for preventing sepsis and also for managing any long-term effects.
Exactly. The more we can raise awareness about sepsis and how important early recognition and treatment are, the better the outcomes will be for everyone.
That's a great point. We need to educate ourselves and others so we can all stay healthy and safe.
I couldn't agree more. It's really about empowering people, and that's why I think this show is so important.
Totally. Speaking of empowering people, when we were talking about those common infections that can cause sepsis,
Yeah.
we mentioned like pneumonia and UTIs,
Mm.
but it can really be like almost anything, right?
Oh, absolutely. I mean, I had this patient once, a young, healthy guy, and he developed sepsis after a simple ingrown toenail got infected. You just never know.
Wow. So it can really sneak up on you, even with things that seem super minor.
Exactly. That's why it's so important to, teach people about the warning signs and when to see a doctor, so they can advocate for themselves.
Really, I feel like a lot of people are like hesitant to go to the doctor for something that seems small.
I know, right? But with sepsis, going early can literally be life-saving.
It really can.
Yeah.
So we talked about how important early diagnosis is, and you mentioned the QSO face score.
Uh-huh.
Can we unpack that a bit more?
Yeah, for sure.
I think our listeners would really benefit from like a deeper dive into that.
Okay, so the QSO stands for Quick Sequential Organ Failure Assessment.
Okay.
It's basically a quick way to check how risky an infection is right there at the bedside.
So it's like a first step to figure out how serious things are.
Exactly. It looks at a few key things: respiratory rate, blood pressure, and mental status. They're looking for those really early signs that an organ might be in trouble.
So if someone's breathing really fast, their blood pressure is dropping, and they seem confused, those are bad signs.
Huge red flags. Those are all signs that the body is, not coping well and things could be heading towards sepsis. But, it's just one piece of the puzzle.
Right.
Doctors will use it along with other info, like the patient's symptoms and medical history, lab results, the whole picture.
So it's not like a diagnosis on its own, but it helps guide the next steps.
Yeah, exactly. Think of it like a triage system. Helps them prioritize who needs the most aggressive treatment right away.
That makes a lot of sense. Speaking of treatment, we talked about how it usually involves antibiotics, IV fluids, vasopressors, supportive care, that kind of thing. How do they decide which treatment to use and when?
Yeah, so there are guidelines and stuff, but it's not, one size fits all. Sepsis treatment is really individualized.
Okay.
It depends on where they think the infection is, how sick the person is, other medical problems, all sorts of things.
So it's like creating a custom plan for each patient.
You got it.
And I imagine that plan can change pretty quickly as the patient's condition changes, right?
Oh, absolutely. Sepsis is dynamic. You got to be constantly reevaluating, adjusting, staying one step ahead.
Wow. So for our listeners who are studying to be healthcare professionals, what are some key things they should remember about managing sepsis, from your experience?
That's a great question. I think the most important thing is to always be thinking about sepsis. With any patient who has signs of an infection, never underestimate this thing. Even little infections can get out of control fast.
So even cases that seem simple at first.
Yeah. Always keep sepsis in mind and be proactive from the very beginning.
What about communication, like with the rest of the care team?
Oh, that's huge. Clear communication is absolutely essential with sepsis. Make sure to document everything carefully. Tell the doctor right away if you're worried about something. Keep everyone in the loop.
So it's all about teamwork, making sure everyone's on the same page to get the best outcome for the patient.
That's it. And, we talked about the long-term effects of sepsis, but I think it's worth going a little deeper, especially for future healthcare providers.
Yeah, for sure. It's one thing to understand the immediate phase,
Yeah.
but the long-term stuff can be just as important, if not more.
Absolutely. A lot of people who survive sepsis have all sorts of problems, physically, mentally, emotionally, long after the infection is gone.
Like what kinds of things?
Well, physically, fatigue is a huge one.
Okay.
Just feeling exhausted all the time. It can be really debilitating. Muscle weakness, joint pain, trouble breathing, all of that.
And those physical problems can really impact their mental and emotional health, right?
Totally. Imagine not being able to do the things you used to. It can be so frustrating and lead to anxiety, depression, even PTSD.
Wow. So it's really important for healthcare providers to address all of that.
Yeah, the physical and the mental and emotional. And it often takes a whole team. Doctors, nurses, physical therapists, occupational therapists, mental health professionals, everyone working together to help the patient get back on their feet.
And family support too, right?
Oh, huge. Family and friends are so important for emotional support and practical help. They need to be patient, understanding, and willing to adapt.
So it's not just about treating the infection, it's about supporting the patient through that whole journey.
Exactly. Sepsis can change your whole life, and healthcare providers need to remember that.
Now, I want to shift gears a bit and talk about something I find really interesting research. What are some of the cutting edge things happening in sepsis research right now?
Oh, there's so much cool stuff going on. One area that's really exciting is the search for new biomarkers.
Biomarkers.
Yeah. Remember we talked about the QSO-FAS score?
Right.
Well, researchers are trying to find specific molecules in the blood that could signal sepsis even earlier.
Wow.
Like maybe even before you have symptoms.
So catching it before it even starts to cause damage.
Exactly. That's the holy grail, early detection and intervention. There's also a lot of work being done on new therapies that target the inflammation. You know how we talked about it's the body's own immune system that goes crazy and causes the damage.
Yeah. It's not just about killing the bacteria, it's about calming down the immune system.
Right. So they're looking at ways to modulate the immune system and stop that harmful inflammation. And some of these new therapies are showing real promise.
That's amazing. It's so cool to think about how much progress is being made.
It really is, and it's important for future healthcare providers to, keep up with all the latest research. It's a fast-moving field.
Absolute lifelong learning, right?
Always. Before we move on, though, I wanted to touch on something we haven't talked about much. The psychosocial impact of sepsis.
Yeah. We've talked about the physical and cognitive stuff, but what about the emotional and social side of things?
It's huge, and it's often overlooked.
Right.
Sepsis can be super traumatic, both for the patient and their family.
For sure.
Imagine waking up in the ICU after days or weeks, hooked up to machines, not knowing what happened. It can be terrifying, and those memories can stick with you.
And then there's the challenge of going back to normal life after something like that.
Exactly. A lot of sepsis survivors have a really long, hard road ahead of them. Relearning basic things, dealing with pain and fatigue, and all the emotional baggage that comes with it.
So healthcare providers need to recognize that the impact of sepsis lasts a lot longer than just the hospital stay.
Totally. We need to be aware of the potential for those long-term problems and be ready to help, both practically and emotionally.
So it's really about seeing the whole person, not just the illness.
Exactly. Treating the person, not just the disease.
I love that. I love that. And, speaking of seeing the whole person, I wanted to circle back to something we mentioned earlier, mnemonics. We always try to provide some memory aids here on Medic Talks.
Oh yeah, mnemonics. Those are so helpful, especially with something like sepsis, where catching it early is so crucial.
Right. Do you have any favorite mnemonics for remembering the signs and symptoms of sepsis? Something catchy that our listeners can use?
I do, actually. There's a really popular one, Sepsis.
Okay, I love a good acronym. What does it stand for?
So S stands for shivering, fever, or very cold.
Okay.
Remember those temperature extremes we talked about?
Right.
Then E is for extreme pain or general discomfort. P is for pale or discolored skin. And then another S for sleepy, confused, or difficult to rouse.
Got it.
I stands for I feel like I might die.
Oh, wow.
Yeah, if a patient says that to you, take it very seriously.
Absolutely.
And then the last S is for shortness of breath.
Okay, that's also I think our listeners will find that really helpful. It covers a lot of the key things we talked about.
It's a good one to remember, especially when you're, in a busy clinical setting and need to think fast.
Totally.
Yeah.
Well, I think we've pretty much covered everything about sepsis in this deep dive.
Yeah, I think we hit all the major points, the, how it works, diagnosis, treatment, long-term effects, even some mnemonics.
Yep. But before we wrap up, I want to leave our listeners with one final thought.
Ooh, I like a good parting thought. What is it?
We've talked a lot about the medical side of sepsis, but at the end of the day, it's about people.
Yes.
Real people whose lives are turned upside down by this condition.
So true. It's easy to forget that when you're focused on the science. There's a human being behind every case of sepsis.
Exactly. So as you go out there and become healthcare professionals, remember to approach your patients with empathy, compassion, and really try to understand what they're going through.
Beautifully said. It's about treating the whole person, not just the disease.
I couldn't have said it better myself. And that brings us to the end of today's episode of Medic Talk. We hope you learned a lot about sepsis today. Remember, knowledge is power, and early recognition and treatment are so important. If you or someone you know has any of the symptoms we talked about, don't wait. Get medical help right away.
And to all our future healthcare heroes out there, keep learning, keep asking questions, and never stop trying to give your patients the best possible care.
Thanks for joining us on Medic Talk. Until next time, stay curious and stay healthy.